Welcome to Medical News Update, turning the biggest health research stories into plain English. Today's story: there's a new weight loss and diabetes drug in late stage testing, and the latest results show some of the strongest efficacy numbers we've seen in this drug class. The drug is called Retatrutide. It's made by Eli Lilly, the same company behind Mounjaro and Zepbound. On March 19, 2026, Lilly announced positive top-line results from a large phase 3 trial called Transcend T2D1. Phase 3 means this is a late-stage trial, one of the final pieces of evidence regulators look at before a drug can be considered for approval. Here is what the trial showed. In adults with type 2 diabetes, retatrutide lowered blood sugar, measured by a test called A1C, by 1.7 to 2.0%, depending on the dose. For context, most diabetes pills lower A1C by around 0.5% to 1%, so this is a notable drop. On top of that, at the highest tested dose, 12 milligrams, patients lost on average 16.8% of their body weight. For a person starting at 200 pounds, that's roughly 33 pounds, from one medication. So why is retatrutide different? Ozempic and Wegovy work on one hormone, GLP-1. Mounjaro and Zepbound work on two, GLP-1 and GIP. Retatrutide works on three, GLP-1, GIP, and a third called glucagon. Think of it as a three-prong approach instead of one or two. The three hormones together reduce appetite, improve blood sugar, and may also nudge the body to burn more calories at rest. A very important caveat: these results look impressive on paper, but they do not prove retatrutide is better than Ozempic or Mounjaro. That comparison would require a direct head-to-head trial, and we don't have one yet. So when you see headlines saying stronger than Ozempic, take them with caution. We can say the numbers in this trial are big. We cannot say one drug beats another until they are tested directly against each other in the same patients. What does this mean for you? First, if you or someone you love has type 2 diabetes or obesity and current drugs aren't enough, there is a powerful new option in the pipeline. Retatrutide is still investigational, meaning not yet approved by the FDA, and additional trial readouts are expected over the next year before any submission decisions are made. Second, powerful usually means more side effects. More patients in the trial reported nausea, vomiting, and diarrhea, common with this whole drug class. That's a trade-off worth weighing with your doctor. Third, don't expect retatrutide at your pharmacy soon. Even if results continue to look strong, approval, insurance coverage, and pricing typically take a year or more after a company files, and when it arrives, it will almost certainly be expensive. But the direction is clear. Every year, the tools we have to treat obesity and type 2 diabetes are becoming more precise and more powerful. Two conditions that, not long ago, we barely had anything useful for. That's today's medical news update. If you got value from this, share it with someone who'd benefit. Until next time, stay curious, stay healthy,